Okay, this is the other part to the articles we're going to look at. Continue with that Newsweek article. Over on your reading right here, I want you to take note of people that seek help amongst your back pain, knee pain, shoulder pain. 14 million, so quite a bit, well over the knee and shoulder pain, go in to visit doctors because of back pain. So choosing surgery, rising number of spinal fusion or vertebra or trimming procedures is going up. And loss of productivity. So back pain creates the most loss of productivity. Okay, up here, there's Richard Deo, and he does recommend trying conservative management first. They even give credit to chiropractic treatment being the most popular non-surgical back therapy. And Deo's view back pain as part of living and being human beings. So he also goes on to say insufficient data to justify treating disc degeneration with spinal fusion. They also pointed to confounding issues like the variation in surgery rates. Nationwide, you're almost 5 times more likely to undergo an operation in Idaho than you are in Manhattan because of community standards and the number of surgeons per people, that kind of thing. So the overall point I'm trying to convey is, unless it's life-threatening, do the best you can to prevent, and that's diet, lifestyle, exercise, core strengthening. And then if something does happen, you can do conservative management first before you go under the knife. Okay, this one, continue with the article. It was a flood of interest in alternative medicine that prompted the Hospital for Special Surgery to open its Complementary Medical Center, also known as CAM, Complementary and Alternative Medical Centers. So these are becoming popular in hospitals. And these CAM units are doing the conservative management parts. They're doing the chiropractic, they're doing the rehab, the massage, and other techniques to help, non-invasive approaches to help people. Okay, over here I want you to also realize that it is very cost effective to do conservative management first. Also, it gets people back to work quicker, and overall it does lower the cost of healthcare and can prevent in the future. So for that person, they get better, they continue with their healthy habits, it can prevent problems down the road. Okay, now other things can influence back pain, as you can tell here. The sports injuries and repetitive motion injuries can be very hard on the spine. These high axial compressive loads are applied to the intervertebral joints during launch and landing. These gymnasts do this over and over and over again for years, and it can lead to other problems. Now that's just the spine. That doesn't include ankles, feet, knees, and so on. Okay, British Medical Journal. Manipulation alone gives better value for the money than manipulation followed by exercise. Okay, so the very least that you can do is at least get the manipulations, the adjustments. It's cost effective and it also works. Also, prior study comparing chiropractic with outpatient treatment found that reduced time off work more than compensated for the additional costs incurred by chiropractic. In this study, manipulation and exercise combined dominated exercise alone, which costs more and achieves less over 12 months, meaning this is a very important rebuttal to claims that patients should do exercise and not do manipulation. So the article is trying to tell you that if you can get both, the manipulations plus the PT, it's better in the long run. Now, I like to add a third component, which is nutrition. So there's your three things. The manipulation stuff itself, PT rehab, soft tissue work and all that, and then nutrition. Keeping in mind that a lot of people are nutritionally deprived and they just lack the proper micronutrients to allow their bodies to actually heal. Okay, so as a bias of mine, those are the three components that I like: the manipulations, the rehab PT, and nutrition. Okay, where is the pain coming from? One of the most common questions I get from people that come in with back pain is like, why does this hurt so much? Where is this pain coming from? Well, the quick answer is it's coming from the disc and the annular fibers and the sinovertebral nerve. Okay, so right here you're seeing the annular fibers, and we looked at that in another online lecture. The outer ring of the disc, so the pain's coming from the annular fibers. Okay. An important aspect of disc nutrition and health is the mechanical aspect of the disc related in the fluid mechanics. Okay, now we looked at another slide on another posted lecture on the disc behavior, the importance of movement. They need to be hydrated. The proteoglycans inside have an affinity for water. The middle of the disc is the nucleus pulposus. The outer rings are the annular fibers. Disc nutrition and health is the mechanical aspect of the disc related to fluid mechanics, movement. The pumping action maintains the nutrition and biomechanical function of the intervertebral disc. That's one reason why sitting is so hard on your disc and can accelerate the degenerative process, disc degenerative disease and arthritis. So unchanging posture, so being static, not moving much, as a result of constant pressure such as standing, sitting, or lying, leads to an interruption of pressure-dependent transfer of liquid. Actually, the human intervertebral disc lives because of movement. So important that you move. So the answer to the question of where is the pain coming from in the chronic low back pain patient, it's in the disc. Studies and clinical experience suggest that mechanical therapy is the most rational approach to relief of this painful condition. A mechanical problem needs a mechanical solution. Chemicals do not typically fix mechanical problems. Okay? You have low back pain, you have degeneration, and you only do medication, that's just masking symptoms. Okay? Mechanical problems need a mechanical solution. Abnormal chemical events related to the rate of blood flow and the nerve root nutrition with the spinal canal are the source of nerve root pain rather than purely mechanical pressure itself. The subluxation complex, or the misalignment, can initiate a neurological sequence of events that results in sympathetic-driven reduced spinal vascular flow. So you're going to be in sympathetics, which is not good. That's your stress system. And you're going to reduce blood flow that gets to tissue. Okay, that's ischemic. That's not good. Spontaneous neural activity can emerge due to relative ischemia, which makes the nerves much more sensitive to mechanical stimulation. It can be assumed that axons and areas of ischemia are bathed with abnormal metabolites and can initiate spontaneous discharge or be more sensitive to minor mechanical stress. So then that answers the question to people that come in, well, why does it hurt when I do this? Why does it hurt when I do that? Well, you have this pre-existing misalignment condition that's creating inflammation, that's putting you in sympathetics, and you're releasing these chemicals that contribute to the pain. And the solution, I like the full package. Do the manipulations, the dry needling, the electric stem, core strengthening, soft tissue release, nutrition, ice, heat, all that PT stuff. It's wonderful. It really gets the area functioning better, the person feeling better, and healing in the long run. Anatomically, the disc is richly innervated at the periphery and outer layers of the annulus by branches of the sinovertebral nerve. Okay, so that is the nerve that innervates the disc, the annular fibers in the disc, and sympathetic nerve. So biomechanical studies indicate that the disc may be capable of eliciting nociceptive function. Okay, remember, nociceptive is pain. We have nociceptive fibers, and if you piss them off, you're going to be in pain. Pathological conditions confined within the disc property were the most probable source of pain. These pathological conditions may include nuclear degeneration, so the middle of the disc is degenerating, annular tears, and biomechanical ground substance degradation. The possible pain mechanism is stimulation of the nociceptive within the disc by a mechanical source, meaning this mechanical irritation is constantly irritating the pain nerves that are found in the annular fibers of your disc. You take a bone and vertebra and disc and you misalign them, you're going to create an aberrant function, localized inflammation, and now you're recruiting the pain. So from the abnormal mechanical source, okay? So that is your subluxation complex. Solution, correct it. Realign the bone, rehabilitate the soft tissue around it. Okay, here's a picture. This is a superior view. So here's your annular fibers. This is where the nucleus pulposus would be. Here's the spinous process, superior articulating process, transverse process, vertebral canal, vertebral foramen. That's where the spinal cord would go. Okay, this is the nerve root branches that you would get off the spinal cord. And then here you're seeing the innervation of the sinovertebral nerve going into the annular fibers. And that is what is recruited when you start to mechanically irritate the disc. The perception of pain is dependent upon the balance of activity in large mechanoreceptor and small nociceptive afferents. Okay, now mechanoreceptor is a new term for you to learn. That is the receptors that help keep you balanced. Okay, mechanoreceptors and proprioceptors keep you in balance. If large myelinated fibers, the mechanoreceptors, were selectively stimulated, the normal balance of activity between large mechanoreceptors and small nociceptive fibers would be restored and the pain would be relieved. In other words, if you begin to move a joint properly, you increase proprioception, which means you're increasing movement, you're increasing mechanoreception, which means you're going to decrease the pain. So, in a lot of cases, movement and the proper therapies alone, just that by itself, can help decrease pain, increase mechano and proprioception. Pain is not simply a direct product of the activity of nociceptive afferent fibers, but is regulated by activity in other myelinated afferents. Remember, afferent is body to brain, and are not directly concerned with the transmission of nociceptive information. Simply put, non-nociceptive afferents close and nociceptive afferents open a gate to the central transmission of noxious input. Bottom line, this is just a fancy way of saying that when pain sets in, the best solution is to begin to rehabilitate the dysfunctional joint by realignment and all of your classic PT that comes with it. Okay, an article that talked about spinal manipulation and treatment of low back pain. Over the past decade, there has been an escalation of clinical and basic science research on manipulative therapy, which has shown that there is scientific basis for the treatment of back pain by manipulation. Most family practitioners have neither the time nor the inclination to master the art of manipulation and will wish to refer their patients to a skilled practitioner for this therapy. Hopefully they will refer. The physician who makes use of this resource will provide relief for many patients.